Welcome to Kidney Corner, an endeavor of the National Kidney Foundation of Indiana. I am Dr. Mahendra Gawani, affiliated with St. Vincent Hospital. In recognition of November as the National Diabetic Month, our topic of today is your kidneys and diabetes. To discuss the subject, we have several guests. Our first guest is Dr. Grant McDougall, who is a nephrologist affiliated with Community Hospitals of Indianapolis. He is going to discuss about kidney disease directly related to diabetes. Dr. Grant McDougall, welcome.
Thank you, Dr. Gavani. Diabetes is the leading cause of kidney disease, as most people know. And early diagnosis is important in preventing progression of disease. The earlier you diagnose, the more you can impact the patient's future. It is recommended with patients with type 1 and type 2 diabetes, they undergo urine testing for protein in the urine 5 years after diagnosis, and then subsequently at least yearly after that, depending on the stages of kidney disease. If the urine shows protein, then further testing is required to determine how much the impairment of the kidney disease there is. Sometimes tests done for other reasons can reveal undiagnosed type 2 diabetes and advanced kidney problems. And sometimes diabetic patients who are not followed regularly present to the emergency room with advanced kidney problems and even need dialysis emergently that night. I cannot count how many times that has actually happened to me in the middle of the night. Next slide. We're going to talk a little bit about the symptoms of chronic Now we'll talk about the prevention and management of kidney disease. We're going to have to restart this. We're actually off our slides.
Yeah.
I apologize.
Okay. Diagnosis.
Yeah, we are
Let's just talk about diagnosis.
Okay.
Diagnosis part before.
This one. That's what I was talking about. Let's actually move on to the symptoms of chronic kidney disease. The symptoms are very subtle, especially in the early stages of kidney disease. Fatigue and difficulty sleeping, weight loss, poor appetite. You can have fluid retention, what we know as edema. You can have muscle cramps if your potassium is high enough, causing profound weakness. Hyperkalemia, which is high potassium levels, can cause cardiac arrest. Usually these symptoms happen very subtly over months to even years, and you may not even notice that it's going on. That's why kidney disease is such an insidious disease that the labs detect it far earlier than your symptoms would present. Usually you don't start even having any symptoms at least until 50% of your kidney function is left. And by that time, it's much harder to impact the future, although not impossible. And detecting kidney disease is so simple. It's a matter of checking your urine for protein and checking your blood for your serum creatinine. And now we'll talk a little bit about prevention and management of kidney disease and diabetes. The key to this is controlling your blood sugars, checking them frequently, checking your kidney function frequently, making sure your protein level in the urine is under good control. Now, the way we control that is with blood pressure medications such as ACE inhibitors and ARBs and renin inhibitors. They prolong your kidney's life. And so taking your medication regularly, checking your kidney function and your sugars are key to prolonging your kidney life. The target blood pressure for kidney disease patients is 130/80 or less. And so checking your blood pressure at home is also key to preventing kidney disease. And these are recommendations not only from the National Kidney Foundation, but also the American Diabetic Association. They also recommending following up with a nephrologist once a diagnosis of impaired kidney function is made. And then once kidney function has declined enough, there's the preparation for dialysis and eventual transplantation. Ideally, it'd be great to have transplant occur before even dialysis is even necessary, but you kind of have to prepare for both because the waiting list is 3 to 5 years on average for a transplant. And then we would also talk to you about the different types of dialysis and what lifestyle would fit you best. And then finally, special considerations for chronic kidney disease patients. Heart disease is 10 times more common in kidney patients, so you have to have a high index of suspicion for any symptoms of heart disease, chest pain, shortness of breath, nausea, sweatiness, that sort of thing. And frequently, when you're first diagnosed with it, a lot of times they end up having to do a bypass surgery right off the bat because the disease is so aggressive. You also have an increased susceptibility to infection. Your immune system is not as strong. And so diligence with cleaning your teeth and being in good good hygiene overall is imperative. You can be anemic with kidney disease, and there are medications we use to help keep your blood count up where it needs to be. It can lead to tiredness and fatigue, obviously. Bone disease is also accelerated with kidney disease as well. You need to take your phosphorus binders. Phosphorus is high with kidney disease, and that can lead to bone loss. And it accelerates heart disease as well. You also have more dietary restrictions with kidney disease as well, watching your potassium, watching your phosphorus that you take in. It can get you into major trouble if you don't watch your diet. You can also get acidosis with that, which can lead to bone loss as well. Blood pressure is much more difficult to control with kidney disease. And also you have to watch with what drugs that other doctors put you on, other nurses. Because they are cleared by the kidney, you don't need as much in the way of dosing of antibiotics, and some you shouldn't use at all. And finally, dialysis is not for everyone. With the aging population, as you get older, dialysis doesn't give you as much benefit as you were as if you were 30 or 40 years old. And so you have to weigh the benefits of living longer with the trials of dialysis in itself.
Thank you, Dr. McDougall.
Thank you.
You gave us good understanding about how diabetes affects our kidney health. Thank you. We will take a short break and come back.
You know, when Margaret and I decided to sell the old estate here, we had only one choice in signage: Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Everyone knows it's easy to find first-run movies in the big theaters. But where can you go to watch your favorite classic movies on the big screen for the perfect night out? Why rent a flick when you can rent the entire theater? Call today to reserve our 32-seat theater for your next event, or just stop by to see what's showing this weekend. The 14 by 7 foot screen and the high quality digital surround sound system offers all the amenities you would expect from the big theaters, with a laid back atmosphere and comfortable seating of your own home. Wofford Theater at 1744 South 10th Street in Noblesville gives you the classic movies you want with a big theater experience.
Welcome back. In our first segment, we discussed the effect of diabetes on the kidneys. Now we are going to focus on diabetes itself. We have with us Carol Dixon, who is a senior manager of the American Diabetes Association, Indiana region. Carol, for joining us.
I'm very happy to be here. Thank you for inviting me. As you mentioned in the first segment, this is American Diabetes Month, and so we have a lot of information that we want to share, and we're so appreciative of the fact that you brought kidney disease and diabetes together and linked it for the audience out there. So what I'd like to talk about are for those who may be watching who are not as familiar with diabetes. So I want to mention some of the risk factors for developing diabetes. So we'll talk about type 1. Type 1 is the, used to be called juvenile onset diabetes. We no longer call it that because adults are also diagnosed with type 1 diabetes. Type 1 cannot be prevented. It's an autoimmune disorder, and there's nothing that we can do to prevent it. Type 2, however, is the type that we used to call adult onset diabetes. We no longer call it that because more and more teens and children are being diagnosed with type 2 diabetes. So, but 58% of people with type 2 diabetes can possibly prevent it, although not everyone, because if you have a strong family history, genetics could play into that, and you may not be able to prevent type 2 from happening. But some of the risk factors for type 2, being overweight or obese, a sedentary lifestyle, being over age 45, ethnicity, having prediabetes, and as I mentioned before, 58% or so could prevent or delay type 2. And what we have found with research is that just a 5 to 7% weight loss can make that happen. Sometimes we're told by our doctor, you have diabetes, you have type 2, you need to lose weight, and we walk out thinking, oh, I have to lose 50 pounds, I can't do that. Well, just think about 5 to 7% of your weight loss. That for a 200-pound person, that's just 10 to 14 pounds, and that can make a big difference. So we want the audience to know that. We also want your audience to know that type 2 diabetes can be very silent. You may not realize that you have it at the onset of symptoms, which we're going to talk about next. You could have it for 5 to 7 years before any of the symptoms start to show, and during that time is when damage could have already started occurring to your body inside. So let's talk about the signs and symptoms. Increased thirst, frequent urination, weight loss without trying, feeling hungry even after eating, fatigue, blurry vision. Oftentimes diabetes is first noticed at the eye doctor's office. Slow healing sores or more frequent infections, tingling or numbness in the hands or the feet, and that's the starting of neuropathy. Vomiting or stomach pain, stomach flu-like. And this is especially critical for anyone out there who's watching who may have children who could be diagnosed with type 1 diabetes, because we have been seeing a great increase, and I have talked to a number of people personally they thought their children had the stomach flu. They went to the doctor said, yeah, there's a lot of stomach flu going around, just go home, drink liquids, take it easy, whatever. Come to find out the child actually had type 1 diabetes. So what we are telling people is to please ask your doctor. If you go to the emergency room, you go to the doctor, just ask your doctor, hey, can we run a blood sugar test? That way you know for sure that it's not type 1 diabetes and that it really is the stomach flu. And then a lack of interest or concentration, and that's because your blood sugars are fluctuating, and so you can't concentrate as well as you would like. So, okay?
Very good. So let's talk about complications.
Yeah, complications. This is where it becomes, very serious for people to know. When I'm doing presentations for people out in the public, I always say this is kind of my Debbie Downer part of my presentation, because there are so many complications and associated diseases with diabetes. Diabetes is the number one cause for all of these complications. Heart attack, stroke. Sometimes the heart hospital has told us frequently that the person who comes in with a heart attack, that's the first time they knew they had diabetes. Blindness. It also exacerbates glaucoma and earlier onset of cataracts. Kidney failure, which we've just talked about, leading maybe to dialysis. Neuropathy and lower limb amputation. Digestive problems because of neuropathy. hearing loss, gum disease. Even the dentist might be the first one to notice that a person has diabetes. Associated diseases, diabetes, and cancer have a relationship, especially with breast, colon, and pancreas cancer, because the abnormally high levels of insulin and glucose combine to create this environment for the cancer cells to grow. And then osteoarthritis or joint damage due to the lack of insulin. And insulin is a hormone that we have to have in order to live. Oftentimes people think it's just a medication that you take, but insulin is actually a hormone that we have to have in order to live. Alzheimer's disease is sometimes referred to as type 3 diabetes. And then for those who have type 1, because it's an autoimmune disorder, it puts them at greater risk for other autoimmune disorders like celiac, lupus, rheumatoid arthritis, and such. So, yeah, diabetes is nothing to take lightly. If you have any family history of it at all, you need to be checked. We recommend an A1C test. An A1C test measures 3 months of your blood glucose levels. It's more accurate than just obtaining a fasting glucose test.
Let me ask you a specific question that the type 2 diabetes is so much more common, you see, and so difficult to prevent. And I want to emphasize again, and I would like you to say a few more things about how to prevent that type 2
Preventing
diabetes.
type 2 diabetes. For those that it's preventable in, it's going to be lifestyle. It's going to be eating healthy. It's going to be physical activity. And we're talking general movement. We just need people to not sit so much. When you're at work, take your phone calls standing up. Get any kind of movement in that you can. Every 60 to 90 minutes, if you're in a sit-down job, try to get up and do something. We recommend 150 minutes of exercise per week. That's 30 minutes a day for 5 days. But that 30 minutes doesn't have to be done all at one time. You can do 10 minutes in the morning, 10 minutes at lunch, and 10 minutes in the evening. Just that minimal amount. And then remember that 5 to 7% weight loss, that's based on research that was done right here in Indiana with Dr. David Marrero and Dr. Ron Ackerman at the Diabetes Translational Center through IU Med School. And that's very exciting.
Well, thank you, Carol.
Thank you for having me.
We appreciate you being with us and educating about diabetes.
Thank you.
We hope that we learn something from this and we all look after our health better.
That's right.
Thank you again.
And our office is local. People are welcome to stop into our office. We're at 86th and Allisonville Road, right next door to the Gert Furniture Building. So you can stop by, or our website is diabetes.org. Okay?
Well, thank you.
Thank you very much for having me today.
We will take another break, and when we come back, we have two special guests. Thank you.
You know, when Margaret and I decided to sell the old estate here, we had only one choice in signage: Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Everyone knows it's easy to find first-run movies in the big theaters. But where can you go to watch your favorite classic movies on the big screen for the perfect night out? Why rent a flick when you can rent the entire theater? Call today to reserve our 32-seat theater for your next event, or just stop by to see what's showing this weekend. The 14 by 7 foot screen and the high quality digital surround sound system offers all the amenities you would expect from the big theaters, with a laid back atmosphere and comfortable seating of your own home. Wofford Theater at 1744 South 10th Street in Noblesville gives you the classic movies you want with a big theater experience.
You're up.
Hello, in our final segment about diabetes and kidney disease, we are pleased to have with us two delightful ladies who have experienced diabetes and kidney disease and went on to have kidney and pancreas transplant. We have Melanie Rigsby and Laura Collins with us.
Thank you.
Welcome,
Thank you very
ladies.
much.
We are going to discuss with you 3 meaningful phases of your life. Life with diabetes, life with kidney disease, and life after transplantation. Laura, let's begin with you.
Okay.
Tell me about the first phase. How diabetes changed your life?
Well, I was 7 years old when I was first diagnosed, so it was definitely a big impact because I was little and there was a lot that you had to take in and learn, your insulin shots, having to check your sugar all the time and everything. So it was a big impact, and then having to take your needles and your insulin with you. I mean, it was a lifestyle change. It wasn't just, here, take this medication. It was your whole life that had to be changed.
Melanie, tell me your story with diabetes.
Well, I was diagnosed when I was 11, and I started out with 1 shot. And how they found my diabetes was I was staying with my aunt, and I drank and went to the restroom all the time. So I ended up on shots, and in grade school, it was hard at times. I did have to take, have my fruit with me when my sugars got low, and insulin with me, and special diet. It was a change for me. I did real well for the first part of it until I did start developing some complications, neuropathy and retinopathy, and some.
And then you developed kidney disease.
Yes,
so
and
tell
then
me
kidney.
of that second phase. How did kidney disease impact?
The kidney disease, I went through the stages. I had a couple kidney infections, one which put me in ICU, and then I had an amputation, a second amputation, 5 inches below the knee, and that put me right into dialysis. And so I was on hemodialysis for 10 months.
Laura, what was your journey like with kidney disease?
Actually, I started having some of the same complications. I was having the retinopathy, and then with the kidney disease, I actually didn't know I had it. It actually came upon my sugars. I was having extreme lows, and that's actually how they had found it. We weren't for sure exactly what was causing it. And since my kidneys weren't actually working, they told me it was called the Samoji effect, is what I was told. And what that is where your body, because your kidneys are not working correctly, you actually store the insulin in your body cannot get rid of it. So when I would go to sleep at night and my body would relax, the insulin would go back into my system, and I would end up with extreme lows. And I was actually, my family had to call the paramedics in to bring my sugars back up, and that's when they suggested that I go and have further testing.
Okay. So now, then you received the kidney and pancreas transplant. So tell me about how did your life got transformed with kidney and pancreas transplant?
It was definitely a new release on life. No more shots. I still had to check my sugars a little bit in the beginning just to make sure everything was where it should be and everything, but you could pretty much go back to eating like a normal person. You still had to watch your diet though and eat healthy, but no more checking sugars, having to give yourself a shot of insulin before your meals and everything. So your life was back pretty much to normal. You were free, I guess you could say. I wasn't tired anymore. I didn't feel like I didn't have any energy. New release on life, definitely.
So freedom from dialysis and shots.
Yes.
That's the main thing, would you say?
Yes, I would.
Now, you had a long journey with kidney and pancreas transplant, Melanie.
Yes.
So tell me about that.
I had my transplant, kidney and pancreas transplant, earlier in.
How long ago?
26 years ago, May 29th of '89. And they hooked my pancreas up, was hooked up a different way, and they went back in and rehooked it up. Wow, it was just wonderful. I, really felt good. Like no more shots, feeling not nauseated, more motivated, and I was able to go back to work for almost 15 years. And here I am today, and it's getting close to 27 again next May, and I'm just very grateful. Grateful.
Knowing you for a long time, I know that you are one of the longest surviving kidney and pancreas transplant patients in the country.
Yes.
Now, I want you to tell me a little bit more about that, your journey with the kind of kidney transplantation, and then what do you miss most in a way that when you were on dialysis and you had a kidney problems? Because the kidney transplantation transformed you so much, right, in many different ways. And 25 years is a long journey. And you worked, and that gave you a big independence. So tell me a little bit more about the work experience and your independence, more the freedom. That's what you got.
I moved, I relocated to Indianapolis and got my apartment, and later my eyes became more stable, my vision, and I was able to drive daylight time with bioptic lenses, and that was great because I really missed driving, and able to get back into the workforce and working with my job. I really loved my job. I worked with special needs, and it was just a wonderful experience. I just loved my life before and after. It was challenging, and I'm grateful to be here today.
Laura, let's talk about a little bit about rejection medicine, because you are on a different sort of rejection medicine. I don't think you are getting any prednisone. So tell me more about us, because now you can do transplant without prednisone.
Yes, I'm actually taking 2 different medications. One is Prograf and the other one is Rapamune. Right now, I have to watch, taking them because, they do lower your risk. You can still pick up, other illnesses and stuff, but I've been doing really great with both of them. I haven't really had any complications with taking either one of the medications. I was on prednisone in the beginning, and then I was able to get off of that, actually.
In the past, and Melanie, you have not been able to come off prednisone because you were transplanted so long ago. But I want the audience to know that nowadays we can do transplant without any prednisone. Okay. Well, thank you for being with us.
Thank you.
Thank you very much.
That brings us to the end of our show. We hope you learned some valuable information. Please contact the National Kidney Foundation of Indiana. And our phone number is 1-800-382-9971. It's a kidneyindiana.org. Tune in next month when we talk with social workers about the emotional, financial, and caretaker issues surrounding kidney disease. Thank you.